everyone, my name is Sophie, and I'm currently a third-year kinesiology student at the University of Guelph-Humber. Today I'll be sharing with you my own experiences and perspective of my time here. So to start, why did I choose to attend the University of Guelph-Humber? I chose to attend the University of Guelph-Humber was first off, the placement opportunities that are provided to kinesiology students. So to provide some background information, in your third year of studies, you get to complete both an on-campus as well as an off-campus placement opportunity. And for me, when I was in grade 12 and making my own decisions about where to go, this definitely was a very important factor for me because I wanted to be able to have an opportunity where I could further develop skills that would help me advance my career. Another reason why I chose the University of Guelph-Humber was due to the small knit community. So personally for me, I thrive in a very small environment. And I've thoroughly enjoyed this because it has allowed me to form very meaningful relationships with my peers as well as professional mentor-like relationships with my professors. One memorable moment that I've had in my first year was when I was able to have these one-on-one interactions with a professor that I currently had a class with. And through these small interactions, I was able to discover that I had a passion towards clinical research. So definitely that was something that I would not have been able to discover if I didn't have a professor there to speak with me and interact with me through that type of small environment. One of my favorite classes, it has to be the human anatomy class. So human anatomy is taught both in a lecture format at the University of Guelph-Humber as well as in a lab format at the University of Guelph, where transportation from the University of Guelph-Humber to the University of Guelph is accommodated by the university through a bus shuttle system. So instead of actually seeing a heart through a textbook or hearing it through lecture, you could actually go into lab, pick up a human heart, be able to open it up, see where the aorta is, see where the ventricles are, see where the intricate details, feel the heart, and actually be able to better visualize it. So this has helped me tremendously in being able to better understand the content. And not only has this helped in the human anatomy class itself, but as well, it serves as a great base, a great understanding base to be able to apply to other classes such as human physiology, biomechanics, biophysics. So the aspect of the labs has helped quite a bit in my learning experience, and it has enhanced it to a very high degree. At a very young age, I had a very close family member to me who was diagnosed with leukemia. And unfortunately, the individual passed away. However, ever since that experience, I have been empowered and have always wanted to work with patients that had experienced cancer or who are undergoing cancer treatment itself. So fortunately enough, I have been able to actually secure a placement through the University of Guelph-Humber, where I'm currently completing my placement at Princess Margaret Hospital in their Cancer Rehab and Survivorship program. So this program is designated for cancer survivors, so patients who have undergone cancer treatments. And the goal of this program is to hopefully enhance their quality of life, health, and well-being to help alleviate the symptoms that are left behind from cancer as well as medications. So my day-to-day activities within my placements include completing fitness assessments with the registered kinesiologist, designing as well as implementing exercise programs to help alleviate signs, symptoms, and various conditions from cancer treatment. One of the most memorable and best aspects of my placement has been the fact that Princess Margaret Hospital is a teaching hospital. And so being able to be in a teaching hospital has allowed me to observe very different professions within the hospital. For example, over the past couple of weeks, I've been able to shadow a cancer physiatrist, a occupational therapist, registered kinesiologist, a dietitian, clinical researchers, and much more. So having the ability and being able to expose myself to these different careers has definitely widened my perspective and helped me better understand what type of career I'd like to pursue after I graduate. So it's helped tremendously in that aspect. Now, aside from my placements, I'm also involved on campus. So ever since first year, I was involved in the Kinesiology Society, which is a society that is held by University of Guelph-Humber kinesiology students with a goal in improving health and wellness of other students on campus. So that has been a wonderful experience. A very common question, which is, what do you want to do after you graduate? And that has always been a very difficult question to answer, and I'm sure many can agree. However, with the experiences that I've had at the University of Guelph-Humber, along with my own experiences, aspirations, and goals, I have taken a very strong interest and will be applying to medical schools in Canada as well as internationally. And one of the main factors that has helped me get to this decision was because ever since I was in second year, I took part in the Alumni Mentorship Program. So this is a program that connects current students to alumni that have completed your program and maybe working in a field that you are interested in. So I was connected with students and alumni who's currently studying medicine in Dublin, Ireland. So when I spoke to her, I was able to have a greater insight as to what medicine really is, and being able to interact with her, listen to her perspective and insights has definitely helped me discover my interest and nurture my interest for medicine.